Hi everybody, it's Michelle here again with Bearth.uhura here at Bearth.uhura. I am a full spectrum plant eating holistic doula and an advocate for all things safe, natural, and effective. Here on this channel, we discuss all things pregnancy, birth, and womb health related. So if you like the content, you like what you hear on the channel, please be sure to subscribe. Today's topic is going to be about reproductive health, and reproductive health more specifically in women, and then even more specifically in young girls. So we're going to talk about this today because I spoke about this on a different platform, and it just was really insightful to see all of the people having all of these issues and their daughters having all of these issues, and people were just so amazed at the things that can contribute to poor reproductive health, and to these problems within our womb area, in our vaginas, in our menstrual cycles, and all of that stuff that we really don't know about. So I talked about this again with just another group of people on a different platform, and it was so much engagement. I really want to bring this here because um, I really think that a lot of people need to hear this, especially mothers with daughters, and even daughters. Like my channel is definitely child friendly. I do get a little emotional here and there, and I might slip on a word, but it's really because of the passion that I have for the work and the passion that I have with for what I love to do and what I believe in. So it's always coming from a place of love. It's always coming from a place of just wanting to help. So let's pretty much get into it. So we're starting to see an increasing number of infertile individuals. Not only are we seeing that, but we're also seeing periods lasting way too long, horrible pains, horrible cramps, horrible migraines. Some of these girls, some of these young girls, 13, 14, 15, 16, 17, can't even get out of bed and go to school. They're bleeding too heavy. They're being put on medication early, specifically birth control. It's no reason why a 9, 10, 11-year-old should have to go on birth control. Even to go on birth control to because they're skipping periods or things like that. I'm going to get into that too. So I really want to just address, because I don't have all day, because I can talk about this all day. So I know I don't have all day here, but we have to get out of the understanding that PMS is normal. Cramps are not normal. Heavy bleeding is not normal. Blood clots is not normal. Headaches, not normal. Nausea, vomiting every time you get a period, or right days before your period or days after your period. It's not normal for any of these things. The cramping in your anus is not normal. And I know a lot of people deal with that, and it's an unspoken thing, but none of that stuff is normal. It is common. It is something that we see that many people are dealing with, and it's becoming more just often, but it's not normal. I personally have young girls in my family who struggle with this. I personally have someone dear to me, a loving family member of mine, and she's young, and she has a horrible time during her period. And honestly, we are not seeing that. We are using the wrong products, meaning menstrual products, whether it be pads, tampons, liners, um, feminine washes, um, sprays to try to eliminate odor, which is also not normal. Um, all of those things contribute to the issues that we're looking at when we're talking about reproductive health. Your many pads, many brands, they have chemicals and dyes and pesticides and all of these different things laced and put on them to create a longer shelf life, to keep the bugs away. And that's ultimately going in your vagina or being absorbed by your vagina. The stuff that we wash our bodies with is contributing to it. The makeup that our young girls are, slapping over their face day in and day out, is contributing to endocrine issues. Um, what we eat, big factor, big factor. Sugar, coffee, chocolate, chips, juice, food coloring, soy. The list could go on and on and on and on and on. Butter, dairy, all of that stuff is contributing to a horrible reproductive system. And this is both in men and women, but we're specifically talking about women and young girls. But young girls have to understand and know that you are destroying your body. Um, and it's not your fault. It's the way we are here in America. It's the way that we have learned. We think these things are okay. We think that these things are normal. We think that just because we're a woman, we have to go through this pain. I hear so much where it's like beauty is pain or pain. No, it is not. You should wake up fabulous and feel amazing about being fabulous. All of this, you know, to be a woman is to, you know, it's just a wrong conception and perception to have. And I really just, you know, we have our young girls out here not even knowing what a vulva is. They don't know what an ovary is. They don't know what an endometrium is. They don't know what a fallopian tube is, a uterus, you know, a womb. They don't know, and you know they don't know that they pee out of, you know, a different hole than their vaginal opening. A lot, and this is not just young girls. Some women don't know this, so we really have to start um, understanding our bodies, knowing our systems, knowing what we ovulate. Ovulation, that's something that they don't know about. Um, you know, how to use a condom if that's what they need to do, because birth control is horrible. Condoms are also horrible, but that's another conversation. And I also have a video on why they are horrible. But all of these things are are conversations that we need to have with our daughters. It's conversations that we need to, yes, they are uncomfortable at first. I have daughters. They are uncomfortable at first, but eventually they will get comfortable and they will get easier and they will get more enlightened and aware. Like they will, you start to become more aware. Your child starts to become more aware. They start to be able to talk to their friends and be a pillar for, be a change maker for their surrounding audiences and the people that they influence. And so this is what we need to be doing. We need to be breaking these chains of um bodily harm. Like we're harming ourselves by harming our reproductive systems. In a woman, your reproductive system is really pretty much your life force. Your endocrine system is very much important um, for the longevity of you, for, you know, your happiness, for your mental level of mental stability. All of these things come from this source. So we really have to just pay attention to how we are treating our bodies, what we are doing to our bodies, what we are putting into our bodies, how we speak to our children, what we're feeding them early on, you know, what we're allowing them to have. Birth control is unnecessary to regulate a child's period, or to even stop heavy bleeding, because that is a band-aid. That is not treatment, because what that's going to do is cause hormonal imbalances, weight gain, depression, all of these different side effects, hair loss or stagnant hair. Your hair might not grow, your nails may stop growing, you know, calcium deficiencies, you know, prohibiting minerals from being absorbed in your body. Like all of these things are problematic and things that come from us having to push medications into our children because they just can't figure out why they are going through what they're going through. They can't figure out why they're bleeding so much. They can't figure out why they're having 2 and 3 periods a month. They can't figure out why there's in so much pain, crippling, debilitating pain. They can't figure out why they are having these suicidal thoughts. They can't figure any of this stuff out. And sometimes birth control makes it worse, and sometimes it doesn't work at all. And so it is really important that we start to look at this on a nutritional level, a spiritual level, and a just loving yourself kind of level. And I just want to put the word out there because these young girls deserve better. No one wants their child suffering month in and month out. No one wants their child not understanding why their body is feel like, you know, they're killing themselves. Like, no one wants that. You know, no one wants to be throwing up and getting dizzy and having seizures and any of that other stuff that comes with these things. Like, I was a personal experience of mine. I have a teenager, and she doesn't have a period yet. And so going to a regular appointment, this is a physical. We're going to the hospital for a physical. And they're like, asking her, like, oh, have you started your period yet? She's like, no. And they were like, you haven't started your period? And she's like, she asks my child, do you know what a period is? And my daughter said, yes, I do. No, I didn't start it yet. And she was like, well, have you ever had a period? Like, and so all of this goes into this full conversation. And then the end of the conversation results in, well, we need to refer you to a gynecologist and maybe get you on some birth control to kickstart your period, because you should be having a period by now. No, she should not. And I let the whole thing go on before I educated this nurse. But I let the whole conversation play out because I wanted to see how my daughter would deal with it and handle it. And I wanted to see where she was going with asking her all these questions. But for me, it was like, wait, it does not, because she's a teenager, does not mean that she has to have a period. And she's like, well, she has all these other signs. She has, you know, her breast is coming in, and she has, you know, pubic hair and blah, blah, blah. And it was like, what does that mean though? These are the signs that you are used to seeing. Some of these children come into your office at the age of 9 with none of those things and have a period. So you can't judge a situation. I said, my daughter has a different diet, you know, separate from a lot of the people that you may know. We don't eat a lot of things. We don't do a lot of things. We don't use chemicals in our home. We don't do this. We don't do that. And so therefore, maybe her body is not ready to bear a child. You know, she's not ready to ovulate. She's not ready to do any of those things yet. And that's normal for her. She's not in any pain. Her levels are fine. She's growing properly. She is healthy. Why are you trying to push that on her? So for me personally, it really just boils down to, well, I want to prescribe you something. I want to give you something because we don't know how to fix it otherwise. So this is what we're going to do because this is the band-aid that we have created and invented. And so therefore we can do this because we just have to do something. We can't take people coming into our office and just being completely healthy because we want something to be wrong, because we want to feel like we're superheroes and we want to do something about it. No, ma'am. We came here for a physical. We're leaving with a clean bill of health. And so this is why I want, you know, young girls to be educated about their bodies. Know your body parts. Know the proper name for your body parts. Know what they are asking of you. Know how to consent for yourself. Know how to say no when you need to, and know when yes is a yes. And so all of these things is really a part of reproductive health and reproductive justice. And so we really need to prepare them. We need to teach them, and we need to provide them with a solid, firm foundation that will allow them to go out into the world and be confident and to know themselves, love their bodies enough to feed it well and drink and hydrate and do the things that they need to do to be vibrant, and to not have to walk around with an attitude while their period is on, and not have to be uncomfortable because they're bleeding super heavy and they have to keep looking down to make sure they're not bleeding through their pants, and to not have to feel like I don't want to go anywhere when my period is on. I just want to lay in the bed and eat chocolate, ice cream, and chips, which is also contributing to the problem. So those cravings are mineral deficiencies. Those cravings are parasites. Those cravings are not anything beneficial to your child or her body. So that's my take on it. I know I was a little passionate. Forgive me if I went a little bit too far, but that was my take on it. If you have any questions, if you want to talk to me about anything, I do one-on-one conversations with young girls. If anyone wants to book a consult with me or talk to me or want me to talk to their child, if it's too hard of a conversation for you to have, I know sometimes, and you know, you don't take things from your mom like you would take things from someone on the outside source, but I do those one-on-one calls as a consultation. And if that's something that you're interested in, you know, that's something that's optional. But yeah, if you have any questions or concerns, please comment, please email us at bearth.uhura@gmail.com. You can find it in the box below or the description. And yeah, just really pay close attention to the signs that your body is giving to you, and teach your daughters how to do that as well. And so I will see you guys for the next video. Thank you so much. I'm Michelle, full spectrum holistic doula with Bearth Uhura. Peace and pregnancy deaths.